We all know we can be bothered by super bright lights or loud noises, scratchy sounds, but some have sensory processing disorder, or SPD. Joining me to explain is WSJ reporter Sumathi Reddy. So Sumathi, thank you for being here.
Thanks for having me.
And first of all, there's this term, SPD, but it's not actually a real disorder.
Well, okay, so it's a little controversial. Sensory processing disorder, which is sometimes referred to as SPD, is not in the DSM, which is sort of the Bible of mental health official diagnoses. So it's not something where you can go to your doctor and they'll say, okay, this is
You've got this problem. All right.
So it's considered sort of more of a condition, and I think it's the big problem with that is that insurance typically won't cover it unless you're in, unless you're an official diagnosis. That's why there are people who are working to try to get it as an official diagnosis.
It seems like adults can have it, but it also seems like this really impacts kids. What are some of the signs or the symptoms?
Yeah, so this is something that usually first manifests itself when you're a child, kind of the preschool ages, like between 2 and 7, I would say, or so even going up into elementary school. Mm-hmm. Not that adults don't have it, they do, but often they learn to cope with it, so it's not as much of a problem. It affects any of the 5 senses, so it can be touch, taste, audio, visual, auditory, as well as it can be balance, which is your vestibular system, or proprioceptive, which is sort of body positioning, body awareness. And typically these kids are they have too much, they're hypersensitive to sensory input. They can't properly process or respond to it. So that can result in sort of like the loud noises are too much for them. If you ever see a child who's just like, they'll have a meltdown.
So something that's so normal for one kid feels extreme
or like texture. So if you're hypersensitive to taste, you're going to have a picky eater, someone who just can't deal with certain types of textured food.
So how do medical professionals work with these kinds of kids?
So this is actually most commonly treated by occupational therapists. This is that's always and it's often kids who have other disorders like ADHD, autism. A lot of those children have problems with sensory processing. But
is there a cure? Is there a fix?
Well, it's occupational therapy. So depending on what the sense is and what the problem is, sometimes kids are oversensitive, sometimes they're undersensitive. So therapy will be different, but it's usually play-based activities, sort of like sensory gyms. You have like ball pits and swings and things that look fun. They'll make up games that sort of give the kids the sensory input they need.
Interesting. And then you point out in your piece, electronics may actually be hurting kids because you don't have, you're watching something, but you're not out there playing like a lot of kids.
Yeah, so one expert mentioned that sort of with the electronics, you're in a 2-dimensional world. So you're not getting the sort of, the sensory stimulation that you get when you're out rolling around in the dirt and playing. So that she thinks that kids that are prone to this, that makes it even worse for them and exacerbates the problem.
Interesting. All right, Sumathi Reddy, thank you for being here.
Thanks for having me.